Hello everyone. In this video, we're going to be taking a look at an article from the Washington Examiner written by Kimberly Leonard, published on January 8th. Democratic chairman begins prep work for legislation to enact single-payer health care. Yeah, they're looking at trying to do this. This is when Ocasio Crazy Eyes Cortez has been made to look a fucking fool with single-payer. It's a losing proposition. The country cannot afford it. This was basically shown with her bullshit with it. Actually, it was more than basically shown. It was actually and factually shown. But yet these stupid fucks are going to still try it. Oh my God. And all they're going to do is screw things over because how they're looking at how they got the cost down is completely shady, shifty, and shitty. All right. To go, oh, it's a little more reasonable. They're literally going to tell hospitals, doctors, so on and so forth, what they can actually fucking charge, as opposed to letting the market dictate this. They're going to demand that they charge certain amounts. Oh, this isn't going to fucking cause doctors to get the hell out of medicine because, you know, they can't make fucking money off of it after spending 6 figures on a goddamn, you know, education to become a doctor. Jesus H. Christ. They don't understand this shit. They don't grasp simple concepts on the left these days. They probably didn't for the longest fucking time. And they just talked out their ass. But anyway, let's get into the article here. House Budget Committee Chairman John Yarmuth, Democrat, Kentucky, has asked the Congressional Budget Office to analyze the effects of shifting all health care costs onto the federal government, a first steps towards Medicare for All legislation sought by progressives, which I honestly believe, didn't the CBO already do this analysis, and it was one of the things that was used to show that Ocasio Crazy Eyes Cortez is knucking futs? Yeah, it actually was. So we've already got them saying we can't fucking afford it. Members of Congress developing proposals seeking to establish a single-payer system will face many important decisions that could have major implications for federal spending, national health care spending, and access to care, Yarmuth said in a letter to Keith Hall, the director of the CBO. Like how you're going to fuck over doctors and hospitals and everyone else? Those the type of things that you're going to be facing on the note of a decision? Oh, God. Yarmuth didn't ask for an analysis of a specific bill, but asked the nonpartisan scorekeeping agency various questions lawmakers should consider as they seek to overhaul the healthcare system. Like, well, maybe you should look at the fact of, without it being a meritocracy and you dictating what doctors can charge and every little aspect of healthcare, because, you know, once they get involved in this shit, they're going to dictate everything. You know, with them doing that, they don't realize that they're going to kill meritocracy and we're going to end up with a subpar, you know, medical system in this country. I mean, that's what you got to look at with this, and that's what's going to happen. You look everywhere there's socialized medicine, they leave those countries to come to, say, the United States to get the best care. So what we're going to do is we're going to lower our fucking standards to these other countries that people, that we say, oh, look at their socialized medicine program that people come from, and fuck ourselves. Real smart thinking. Really smart thinking there, Yarmuth. I mean, look, you know, here's his tweet, which they get into here. But look at him. You know, the ACA made it possible for millions to gain health insurance for the first time, but there are still too many Americans who cannot afford their health care costs. Today, I requested a CBO report on various proposals to establish a single-payer health care system in the U.S. Okay, do you know who a lot of those people who cannot afford health care are? They're middle-class Americans who had fucking health care until you decided to give a few fucking poor people fucking health care and fuck them with the ACA, you dumb shit. You fucking retard. You are seriously fucking retarded, dude. To honestly put that out there and go, well, the ACA made it possible for millions. Yes, and it kicked more people off of fucking insurance that have to pay the tax penalty. Or then it actually helped, because this millions thing is some bullshit fucking number that you people pull out of your fucking ass. Honestly. And a bunch of these people are, don't even have actual decent fucking insurance when they have an $8,000 deductible or some shit like that. And it's a health insurance savings plan. And in part because of you fuckers, they have that shit. Because of the ACA. Because the insurance companies were colluding with you dumb fucks. And wrote the shit to benefit them. Insurance was better a decade ago, and more people could afford it because it was better a decade ago. Because the insurance companies didn't get to dictate shit with the Democrats. And there were more middle-class people who could actually afford insurance. If you're middle class and you can't afford insurance, there's a serious fucking problem. Because the middle class should be able to afford insurance. But, hey, fuck the middle class. You got some dumbed down, low IQ, low information Democrat voters. Some fucking insurance. So you're fucking happy when you say, oh, the ACA helped millions of people. It only helped Democrat voters that are, dumbed down fucks who are going to go, oh, the Democrats got me insurance. I'm going to go vote Democrat. That's what you fucking got, you dumb shit. Actually, no, you're not a dumb shit, because you know exactly what you got. Yamas said in a statement that his request for the score is aimed to inform House hearings on single-payer proposals. Such hearings would be the first step in the process towards passing legislation enacting single-payer systems, a top goal pursued by progressives like Senator Bernie Sanders and Rep. Alexandria Crazy Eyes Cortez. Yeah. The two biggest fucking jokes in Congress. Well, Senate and Congress, both the House and the Senate, though. But yeah, two biggest... The fucking commie jokes of Congress. Crazy Eyed Cortez was told this shit wouldn't fucking work. And then when she heard about an accounting error at the Pentagon, go, we got billions right there. It's like, bitch, the money's... It's not like it was found money. It was found that the money was missing, but it was already accounted for, you dumb bitch. I mean, this is the type of stupidity we have. Sanders and Ocasio Cortez, who honestly think this shit will work. And now you get the left jumping on board with this shit, thinking that they're going to get this the Democrats think that they're going to get this to fly. Even if the CBO fucking slants the shit out of it, pads the fucking books, cooks them. All right? They're still going to look like shit, and they're not going to have any ground to stand on with this. In the letter, he asked CBO to evaluate how the healthcare system would be financed, whether private insurance companies would play a role, whether patients would face any costs, what methods would be put in place to contain costs, what rules would be placed on hospitals and doctors, how to set reimbursement rates, whether to do away with other government healthcare programs in favor of a single one. Yeah, so basically, they want the CBO to evaluate whether private insurance companies are going to play a role in Medicare for all. Well, number one, it's Medicare for all. The insurance companies would not play a role. All right. Unless they pull the ACA type shit and they write the stuff themselves, they would not have a role in it because it'd be run by the government. Then you have whether the patients would face any costs. Well, if you're talking about a true single payer system, they wouldn't face any costs because the government would just pay for it. They're talking about single payer. That's easy to right there. What method would you put in place to contain the cost? Well, the method they can put in to contain cost would be to do things like ration care, which means they would deny you care. Look at the UK. They've been busted. The NHS has been busted for this multiple times with the doctors literally denying care to elderly because they felt that their lives were long enough and they shouldn't be, extended. Because it takes away from younger people. That's going to happen here. All right. They're going to give that power of life and death to these doctors, to these, to unelected people that have no medical backgrounds. And they're going to decide whether you live or fucking die. They're going to decide whether or not you get care. Because that's the only way to try to contain cost, is by rationing care itself. On the note of the rules being placed on hospitals and doctors, they're going to place so many rules on hospitals and doctors, so many regulations, that the private sector is going to get out of the shit, because it's not going to be profitable for doctors, after spending 6 figures on a fucking education to be a doctor. Hospitals, no private hospital is going to work under the system, because they're not going to be able to turn a profit. This setting of reimbursement rates, they're going to tell these doctors and what hospitals, what they can and cannot charge for things, as opposed to letting the market dictate this, which is going to basically create an environment where it's going to drive doctors and hospitals out of the business, because hospitals are going to be closing their doors and doctors are going to be looking at something else to be doing. And this idea of doing away with other government healthcare programs in favor of a single one. If you're going with a government healthcare program, there's no reason to have Medicaid, Medicare, and others. So you might as well roll the VA into it too. I mean, if you're going to have the government running healthcare, they might as well just run it all under one fucking program. It would just make sense. I mean, which doing it anyways doesn't make any sense. Yarmouth is a co-sponsor of the Medicare for All Act, a bill that would enroll everyone in the U.S. onto the Medicare program, doing away with private insurance, Medicaid, and other government programs. Currently, more than 55 million are enrolled in the program, which covers adults 65 and older, as well as people with disabilities. Yeah, and if you look, everyone who's pretty much on Medicare that's 65 and older, they have supplementary fucking insurance, because Medicare sucks big fucking syphilitic donkey dick. Holy shit. Go look. Almost every single retiree has a secondary fucking insurance, because Medicare sucks big syphilitic donkey dick at a Tijuana fucking donkey show. Jesus H. Christ. They try to make it sound like a positive. I don't understand this. The Washington Examiner is usually conservative, but this is kind of like liberal shit here. One study from the Free Marketus Center at George Mason University estimated that government spending on healthcare would rise by $32.6 trillion over a decade in a single-payer system, an estimate that is in line with an earlier study by the left-leaning Urban Institute. Yeah, it's probably going to cost more than that, because if you remember, the CBO and these fucking think tanks and all these other things said that Obamacare was going to cost a lot less fucking money than it actually ended up costing the American taxpayer. They said it was going to keep that rates were going to be a lot lower than they were. They said all this fucking shit about the money, and they didn't know what the hell they were talking about. It was clear they had talked out of their ass. So that $32.6 trillion, I'm not buying it. It's going to be more than that. Common sense tells us that. The study concluded that overall spending, not just government spending, would be $2 trillion less compared to where spending is projected under the current healthcare system. But that would come mostly through cutting payments that hospitals and other providers were getting from private insurance by about 40%. So they're literally going to cut what hospitals and doctors can charge by 40%, 10% short of half. So almost half, we'll say, by the bigger scheme of things. And they don't think that's going to affect the quality of health care? Are you kidding me? That's more than going to affect the quality of health care. It's going to drive it into the fucking toilet. And if you have to literally cut things by 40%, to say, look, we can do $2 trillion less compared to where spending is projected under the current healthcare system, you're pretty fucking desperate. Because even with that additional 40%, it's still cheaper, you stupid fucks, to have our current healthcare system. And you don't have to be a sleazy, scummy, shitty person and dictate what a hospital or a doctor can charge as opposed to the market. Because, when there were more doctors, you could go to the doctor for a few bucks. You could walk in, pay cash. It wouldn't be a big fucking deal. But as the amount of doctors decreased in the country, the price of going to the doctor has increased because of supply and demand. There's a high demand, but there's less supply of doctors, so they can charge more. Jesus H. Christ. I mean, they're literally like, well, we got it $2 trillion less. Yeah, but you literally had to cut what money's going to doctors and hospitals by 40% without even looking at the fact of, is that 40% cut still going to be allowed for their expenses to be covered? Jesus H. Christ. And then this part here. Higher taxes may be under consideration to have Medicare payments align more closely with those of private insurers. Bullshit. You'll end up paying more in fucking taxes than you would for health fucking insurance. Holy shit. Jesus H. Christ almighty. All you need for proof of that is to go look at the type of taxes that are paid in Western Europe with all their socialized health care. Part of the reason why their taxes are so high, in large part actually, is because they're paying for, like in the UK, NHS. Holy shit. Wow. You would think when JoJo the Idiot Circus Boy could figure out this shit, other people would be able to figure it out, especially these people on the left that are like, Medicare for all. Oh, excuse me, Medicare for all. Senator John Barrasso, Republican Wyoming, had asked CBO to score the Medicare for All Act introduced by Sanders. In taking up various requests, CBO analysis tend to focus on bills that are closer to passage. Well, yeah, they really don't want to take a look at that, because if they were to take a look at that, it would kind of stop this shit dead in its tracks. I mean, this is some fucked up shit. They're literally like, oh, let's do Medicare for all. And you look, the only way that they can bring themselves in cheaper is by fucking over doctors and hospitals by cutting down what they take in by 40%. Holy shit. I mean, this is some funny shit here, how they can actually think that people will buy into this, oh, we got it $2 trillion cheaper. Or buy into it only going to cost $32.6 trillion when Obamacare cost a hell of a lot more and is a hell of a lot shittier. Oh, these fucking people. Oh, God. Anyway, I think I've covered this well enough. Yeah, I'm just going to leave things here. If you liked this video, depending on where you are watching it, please give it an upvote or thumbs up. If you want to know when new content of mine hits the internet, don't forget to subscribe to one or more of my social media or video accounts listed here. Also, with YouTube, don't forget to ring that bell. You can find all of my video content on both BitChute and YouTube. This may not be the case with other places I upload to, but I will try to minimize this happening. You are always welcome to interact with me at any of these sites on the list, so feel free to do so. If you have anything you want me to cover in a video, when it comes to news or current events, send it right along to me. I will try to do my best to cover it. As always, thank you for watching.